Please subscribe and don't forget to press the bell icon to get notified whenever we upload a new video.
Well, our top story continues to be the rehabilitation efforts on in the state of Kerala. Joining us now, Rajeev Sadanandan, the Health Secretary from Kerala. Sir, appreciate you joining us here on CNBC TV18. You have just concluded a review meeting with the Chief Minister. Give me a status check of what things are like on the ground, sir.
Well, the good news is that there are no more rescue efforts to be done. All the people who have been marooned, isolated in different places, have been rescued and brought to the camps, or the waters have received from that place, and everyone is there's no threat to life left. But we still have 3,259 camps and about 196,000 and odd families still living there. Many of them find it difficult to go back because the houses are uninhabitable, and there is the threat of infectious diseases breaking out.
Mm-hmm. Just on that issue of the threat of infectious diseases, I'm looking at a statement that's been put out by Dr. Shashi Tharoor. He has, of course, met with WHO officials and UN officials. In this statement, he says that the WHO is in position to offer Kerala rapid diagnostic kits to test water filters and monitoring NCD patients on medication. Is there a requirement for the WHO to step in and provide this sort of assistance? Is this what the state government is looking at?
We already have people from the WHO working with us. They're working with us surveillance medical officers. I mean, they're national officers who are working with us. I had a conversation with the Deputy Director General, Dr. Soumya Swaminathan, and the India WR representative. As of now, we do not need anything more sophisticated, because right now what we're doing is looking for infectious diseases, and our diagnostic systems are quite capable of taking care of the possible threats that could come up. In case there are cases of encephalitis and so on, which needs looking at different panels, the National Institute of Virology and the Manipur Virology Research Institute, who worked with us on managing the Nipah crisis, are available to us. And right now, I don't think any more support from the WHO. The national systems are quite capable of taking care of them.
Okay, so you're saying right now you don't require any further assistance from the WHO, though you're already in touch with them. But what about antibiotics? What about medicines, vaccines, etc., for the possibility of leptospirosis or any of those other critical issues that may crop up?
Our antibiotic stock is sufficient. In fact, we are right now about 40% more than what we need. We intend to ramp it up to 100% redundancy. The leptospirosis in itself is not something that needs advanced antibiotics. Either simple antibiotics like crystalline penicillin and doxycycline is capable of taking care of it. We've also issued an advisory on prophylaxis against leptospirosis using the antibiotic doxycycline. So lepto is not a major threat. In any of these diseases, the issue is not management. The issue is what are your systems that can pick this up immediately, and how good is the response to contain the epidemic? And that is what we're focusing on.
Okay, so what have you been able to do in terms of being able to put the safeguards in place, both in terms of management as well as anticipation?
We are in what the disaster management people call the recuperation phase. The initial one was the rescue. At that time, we were focusing on the people who are being brought in. And right now, our focus is, and even now, on the camps, because we are worried with so many people living together. And having had, before the floods came, we had an outbreak of leptospirosis and chickenpox. So we expect that many of the persons who went to the camps following the flood would have been carrying these microbes and could have infected others.
Okay.
So right now, our focus is on three areas. One is to see whether any residue of the old chickenpox and leptospirosis cases are remaining and where they have caused infections. And the other one is the first worry after a flood, which is the acute diarrheal diseases. These are three areas that we are currently watching for. While the surveillance takes care of all the three, but these are areas of concern as of now.
These are specific areas of concern that you are watching out for. In terms of the efforts on currently, sir, as you said that the rescue operations are now over and the focus now shifts to rehabilitation. What will be the priority areas from here on?
No, rehabilitation will wait some more time because right now it is there are lots of things to be done. There are houses to be cleaned up, and during the cleanup we expect a lot of snake bites. That's one area that we're focusing on immediate attention to snake bite victims. And the second part is going to be all the water sources have been contaminated, cleaning up the water sources and ensuring that safe water is provided. And people have been off medications for a few days. During the time, people who are on insulin, who are on the anti-hypertensive drugs,
right.
Because of what is coming in, they have been off medication for the last 3 or 4 days, which exposes them to lots of cardiovascular and neurological complications. That is the other area that we are currently watching for. Now, once this part is over and when the rehabilitation starts, the focus is going to be, we have lost about 58 institutions, of which 9 of them have been totally lost, and 8 primary health centers, 4 community health centers, and 1 sub-divisional hospitals, and some sub-centers have been lost. So the first part is going to be finding accommodation for them and rebuilding them. And we have lost our equipments in most of the flood-affected areas. There was no time to evacuate the equipment. So that they will have to be replaced. So that was going to be the first priority.
Right.
Bring our infrastructure, which Kerala is known for, bringing it back to speed. That's the first part. And then it's also possible that we'll have a lot of downstream complications of the what I mentioned before, the non-communicable diseases, whose management they've been off management for about 3-4 days. So what we're doing with the non-communicable diseases as of now is taking our register that is maintained centrally and going back and checking back on all of them to see that whether their hypertension and glycemia levels are under control, and if they're not, I'm managing it. The other area we are focusing on is we were on route to TB elimination. Within a few years. So the 27,000 people we had on treatment, we're going back and verifying whether they are there, so that our movement towards TB elimination is maintained. So a lot of work to be done.
Yes, clearly, sir. So I will end then by asking you a final question, sir. And again, I refer back to the statement that's come in from Dr. Shashi Tharoor. He says that the state government should examine whether it requires a multi-sector assessment by UN agencies, which include the WHO, the UNICEF and the OCHA. And he also says that the state government could request for the 2 million WHO stock of anti-cholera vaccines to minimize the risk of grave waterborne diseases. Do you feel, at least on the second part, on whether you require the anti-cholera vaccines from the WHO, or do you believe that you have enough?
Anyway, again, let me explain. We work very closely with the India office of WHO, the South Asian Regional Office, and the Geneva headquarters. In fact, we have been closely working with them for a few years, and we had a discussion with Dr. Soumya Swaminathan on vaccination. What we feel is that the incidence of cholera in Kerala is not very high. And cholera vaccination, what we have right now, has a 30% efficacy. And it will be better for us to focus on the surveillance systems and effective management than on the cholera vaccination. WHO Geneva is also suggesting some other vaccines, which we'll be looking at. As of now, that is not under consideration.
Not under consideration. Mr. Sadanandan, always a pleasure, sir. Appreciate you joining us here on CNBC TV18. I know it's a busy time for you. We wish you the very best of luck and appreciate your time here on the show. It is now time for us to head into a short break, but when we return, there's a lot more. Stay right there.